Taking into account my earlier findings, I estimate that in all, Shipman probably killed about 250 patients.
What evil lurks behind the facade of a seemingly ordinary doctor? In the annals of criminal history, Harold Shipman, also known as Dr. Death, stands as one of the most prolific serial killers of all time. His horrifying crimes shocked the world and left an indelible mark on the study of criminal psychology and medical ethics. Today, we delve into the macabre story of Harold Shipman, exploring the disturbing reality behind one of the most infamous criminals in modern history. Harold Frederick Shipman was born on January 14, 1946, in Nottingham, England. He was the second of 4 children in a working-class family. From a young age, Shipman exhibited an air of superiority and a strong sense of independence. His mother Vera was a dominant influence in his life, instilling in him a sense of being special and different from others. Her death from lung cancer when Shipman was 17 had a profound impact on him. He witnessed her suffering and the administration of morphine to ease her pain, an experience that would later resonate in his own criminal behavior. Shipman pursued a career in medicine, attending the Leeds School of Medicine and graduating in 1970. He married Primrose Oxtoby while still in medical school, and the couple went on to have 4 children. Shipman's early career was marred by controversy when he was caught forging prescriptions for pethidine, a painkiller for his own use. He was fined and briefly underwent rehabilitation but returned to practice, seemingly rehabilitated. In the late 1970s, Shipman established his own general practice in Hyde, Greater Manchester. He became a respected and trusted figure in the community, known for his dedication to his patients, particularly the elderly. However, behind this facade of a caring doctor lurked a sinister secret. Shipman was systematically murdering his patients by administering lethal doses of diamorphine, a powerful opioid. The scale of Shipman's crimes is staggering. It is estimated that he killed at least 250 patients over a span of more than 2 decades, making him one of the deadliest serial killers in history. His victims were primarily elderly women, many of whom trusted him implicitly. Shipman would often visit them at home, administer a fatal dose of diamorphine, and then sign their death certificates, attributing their deaths to natural causes. His position of authority and the trust placed in him by his patients allowed him to carry out his crimes with impunity for years. The breakthrough in the investigation came in 1998, when the daughter of one of his victims, Kathleen Grundy, raised suspicions. Grundy, a wealthy widow, was found dead at her home shortly after a visit from Shipman. Shipman had claimed she died of old age, but her daughter was shocked to discover that her mother's will had been altered to leave everything to Shipman. This led to an exhumation of Grundy's body, which revealed lethal levels of diamorphine. As the investigation unfolded, more bodies were exhumed, and the extent of Shipman's crimes began to emerge. In 1999, he was charged with the murders of 15 patients and stood trial later that year. The trial was a media sensation, drawing intense public and media scrutiny. The evidence against him was overwhelming, with detailed records of his visits to his victims, the sudden and unexpected nature of their deaths, and the large quantities of diamorphine found in their systems. On January 31, 2000, Harold Shipman was found guilty of 15 counts of murder and 1 count of forgery. He was sentenced to life imprisonment with a recommendation that he never be released. Shipman never admitted to his crimes, maintaining his innocence until his death. On January 13, 2004, Shipman was found dead in his prison cell, having hanged himself with bedsheets. Harold Shipman's case had profound implications for the medical profession and the criminal justice system. It exposed significant flaws in the monitoring of medical practitioners and the certification of deaths. The Shipman Inquiry, a 2-year investigation into his crimes, led to major changes in the oversight of doctors in the UK. In retrospect, the case of Harold Shipman raises critical questions about the nature of trust in the medical profession and the potential for abuse of power. How could a doctor sworn to protect life commit such heinous acts? What safeguards can be put in place to prevent such a tragedy from occurring again? These questions continue to provoke discussion and reflection, contributing to a broader understanding of medical ethics and patient safety. The psychological impact on the families of Shipman's victims cannot be overstated. They endured unimaginable grief and horror as the details of their loved ones' final moments came to light. The pain of such loss is compounded by the betrayal of trust by a figure who was supposed to care for them. Many families have sought solace in advocacy, working to support other victims of medical malpractice and pushing for legal reforms to prevent future tragedies. Moreover, Shipman's case has had a lasting influence on popular culture and public consciousness. Numerous books, documentaries, and films have attempted to dissect his personality and crimes, seeking to understand the mind of a man capable of such evil. The story of Harold Shipman also highlights the resilience of survivors and their families. Despite the darkness of their experiences, many have found ways to honor the memories of those lost and to work towards a safer, more aware society. Their courage and dedication are testaments to the strength of the human spirit in the face of unimaginable evil. As we reflect on the case of Harold Shipman, several key questions arise. How did a man who seemed so ordinary manage to hide such a dark side? What can we learn from his case to prevent similar tragedies in the future? These questions continue to resonate with criminologists, psychologists, and medical professionals, driving ongoing research and debate. The investigation into Shipman's crimes also underscores the importance of community vigilance and the role of the public in aiding law enforcement. It was the suspicions of a grieving daughter that ultimately led to his capture, demonstrating that even the smallest piece of information can be crucial in solving a case. The public's cooperation and the willingness of individuals to come forward with information are vital components in the fight against crime. Shipman's ability to maintain his facade for so long also highlights the need for better monitoring and regulation within the medical profession. Understanding the psychological factors that contribute to such extreme behavior is essential in developing strategies to identify and address potential threats early. Medical professionals play a critical role in this process, providing the necessary oversight and intervention to prevent potential threats from escalating. In the wake of Shipman's capture, the community of Hyde had to come to terms with the fact that a monster had been living among them for decades. The process of healing and rebuilding trust was long and difficult, but the community's resilience shone through. Support groups, memorials, and public awareness campaigns emerged, helping to foster a sense of solidarity and determination to prevent future tragedies. What are your thoughts on Harold Shipman and his crimes? Do you believe more could have been done to prevent his killing spree? Share your thoughts in the comments below. Your insights and perspectives are valuable to us and contribute to a deeper understanding of this complex and disturbing case. If you found this video engaging and informative, be sure to like and subscribe for more in-depth investigations into the world of true crime.